the show. Let's talk health with Dr. Yash Gulati. We all know that corona is causing COVID disease, which is pandemic all over the world. How this coronavirus damages our body, most people do not know. The fact of the matter is that it causes what is known as thrombosis or clotting in the blood vessels, and that is the culprit. To discuss what is thrombosis, how all this works, does it happen in normal people, what normal people should do, we have with us a very prominent vascular surgeon, Dr. Rajiv Parakh, who is the chairman of vascular surgery in Medanta Hospital. Dr. Parakh, you're very welcome.
Good morning.
We all know that all this trouble that is happening is because coronavirus causes clotting in small blood vessels. What is this thrombosis or clotting in the blood vessels?
Actually, I think you've raised a very pertinent question. The thing is, let me just take you back a little bit in history. When it all started in Wuhan and then it went on to Italy, nobody really knew what it was. Everybody thought it was just a viral pneumonia. And that is why all the hullabaloo about getting ventilators, ready and up for ventilation, everybody was going in for ventilation. Eventually, a few post-mortem examinations were done on the patients who had actually died. And then they realized that it was just not a viral pneumonia. There was a lot of inflammation going on and there was a lot of clotting which was happening. Clotting was happening in the lungs, clotting was happening in the heart, clotting was happening in the brain, and clotting was happening in the peripheral blood vessels. So it wasn't just a viral pneumonia, it was actually a thrombotic disorder or a clot-causing disorder. And that is the real culprit now.
Because this virus which was causing the clot.
That's right. The virus was not actually causing the clot. The virus was creating an immune response, a reaction that was creating all the clotting.
Sure.
So if we suppress the immune response, we would reduce the clotting. If the clotting had already started, that is the reason why anticoagulation or blood thinning injections have been started and are now in the forefront. I mean, the forefront of the treatment are steroids and anti-clotting injections.
Yeah, Dr. Parakh, even if there is a bleeding from hand or anywhere in the body, when the blood comes out, it clots.
Yeah.
So, can that happen in the body when the blood is flowing? And if it does happen, why would it happen in the body? Because if it clots in the body, then we are dead.
Yeah, that's exactly what happens. That's what a heart attack is. Whenever there's a clotting either in the heart or in the brain, in the heart, you get a heart attack. If there is a clotting in the brain, you get what is called a brain attack or a heart attack of the brain.
But why would it happen in the body?
Because a clot develops because of a collection of blood, of the blood products, which is platelets, and a product which is called fibrin, which clumps together and forms a clot. This is what happens even when we are injured and the blood flows out. And that also happens inside if there is some other factor which is activated, which creates this sort of situation, which can actually start clotting.
You mean this virus is now helping activate that factor because our immune response is less?
That's correct. It is. Yeah. This is why it is called a thromboinflammation. That means the virus is activating an inflammatory response or an immune response, and the products of this immune response are the ones which are increasing the clotting inside the blood vessels. No injury, no trauma, no cuts, but the blood just clots.
And what are the blood vessels which can get affected with this clotting in our own body?
Any blood vessel. I mean, starting off with the heart, people get heart attacks. You may have heard of young people having or succumbing to heart attacks. You may have heard of young people developing strokes because it can affect the blood vessels inside the brain as well. Then I'm a vascular surgeon, as you know, at the Medanta Medicity Hospital in Gurgaon. On an average, let me tell you that, we basically treat blood vessels which are blocked in the arms or the legs. On an average, we see close to about 300 to 350 patients per month. That is on an average prior to the corona period. Currently, we are seeing over 500 of these patients, and there is an increased number of patients with sudden onset of clotting. We normally, as I said, if the process has gone beyond a point, the blood vessel completely clots and the patient develops gangrene. Now, that's a very tragic situation.
And have you seen gangrene because of corona-induced thrombosis?
That is absolutely correct. We have seen sudden, spontaneous clotting in patients who come to us with acute blockage of the arteries, and we have lost a lot of limbs. We have, on an average, we do about 20 to 25 amputations per year at Medanta. This time, in the last 6 months, we have already done 65 amputations.
So why is it that we could not save those amputations? Why? Did the patient come late? Was it diagnosed late? So what we can do to prevent that scenario from happening?
Yeah, so that's a very pertinent question. These patients all came very late because you see, when they got the corona, the concentration was primarily towards the lungs and the other conditions that were being caused. And they were either missed or misdiagnosed or not actually understood as to what was happening. They were developing these clots, and these clots, once the leg becomes cold and then it becomes completely dead, when the muscles and the tissues die,
then it is
then
irretrievable.
it's
So
irreversible.
what can we do? I think the first thing would be to create awareness amongst general public. So what should they be watching for in this scenario so that they don't come to this stage?
Yeah. So the important thing that one has to do is to, if suppose somebody is suffering from corona, the of course, apart from all what your general, your clinicians are doing to you and all the medication, of course, follow those under supervision. Don't try and treat these conditions at home without any supervision. Must go to your doctor, follow him up either on a video consult or whatever. Now for yourself, what you really can do is, if you can, just feel the temperature of both your arms, your legs and your feet and your hands. If the temperature of both the legs, the feet and the hands is the same, you are by and large okay. There should not be any other problem. But if one leg or one foot becomes colder or cooler than the other, then that's a cause for concern.
That's alarming.
That's alarming. Along with that, there will be severe pain, because this is a blockage which occurs suddenly. When it occurs suddenly, there is a sudden blockage in the blood supply, and that actually causes severe pain. So it's like an excruciating pain in the leg, and it seems as if everything has stopped. The leg becomes cold, it becomes very tender to touch, movements disappear. You cannot move your
But that would be very late, won't it?
Of course.
So we want to really catch it before that.
So for that, you have to examine yourself, meaning feel the temperature in both your arms and legs. Make sure that the movements of your ankles and your hands and your fingers is absolutely pain-free.
Pain-free.
There should be no pain. That's right. There should be no pain when you move your your hands and feet. And if that be so, then the chances of at least the peripheral arteries blockaging, that can be picked up.
So if there is sudden severe pain, if there is a temperature difference, if there is difficulty in movement of the hands or feet, then you must consult your doctor immediately.
Absolutely.
So what happens? There are some people who are already prone to these vascular problems, for example, who are diabetics, those who smoke a lot.
That's right.
So what would be your advice to such people?
See, in any case, corona or no corona, if you're diabetic, you need control. You need very good control. You need to keep your HbA1c levels less than 7. And smoking is a complete no-no before corona, and now even more so. And a combination.
Even one cigarette is harmful.
Even a puff is not something.
Even passive smoking is
absolutely,
harmful.
Absolutely right.
So we need to stay away from smoking.
You have to stay away from smoking. As I always say, that when you are consuming poison, whether you lick it or you take a kilo of poison, it's not as if you're going to die more. You are going to be dead with that lick. So it's the same with cigarette smoking. Even if it's passive smoking, it's harmful for you, especially in this time. If you're a diabetic, if you're hypertensive, or if you're prone to any other heart and other lung conditions, then smoking is a complete no-no, even more so now.
Yeah, unfortunately, Rajiv, what happened was that during corona time, people were confined indoors, they were working from home, and actually smoking increased amongst people.
That's correct.
So would you not tell them, just don't do it?
See, the most important thing, actually, unfortunately, because of the lockdown, because of the work from home, because of the stress and the strains of living together in a cramped, small environment, not able to go out, not meet your friends, not be able to de-stress yourself with either exercise or other things. This caused an increased surge in the consumption of alcohol and cigarette smoking, both of which have actually created havoc for these patients.
Yeah,
so
if it does happen, Rajiv, unfortunately, if it does happen in early stage or in late stage, so how will we manage? How would you manage that?
Well, I mean, it should be picked up as early as possible before the state of gangrene comes in, because then, of course, it's a no return. So it has to be picked up. You need to go and see your own doctor. You need to tell them that your feet and arms or your hands have become cold. And if there is any other situation like pain or discomfort, you need to get on, inform your doctors. The doctors need to start you off on anticoagulants, meaning blood thinning injections, and hopefully that does subside and it does actually improve the situation. But of course, it can sometimes progress if the other conditions, that is the lungs and the heart and the other conditions, sometimes can take precedence.
But if it is caught early, it is retrievable.
Absolutely. If it is caught early, we have operated on numerous patients in which we actually picked up these patients and we were able to remove the clots and then continue with the blood thinning injections, and they were able to.
So that is a very important message, Dr. Parakh, that
yes.
we should be on the lookout that we are not developing this, especially in corona times, especially people who have diabetes, those who smoke. Please don't smoke. Number one, I think you need to quit this, as Dr. Parakh said.
Absolutely.
And if you're in doubt, it's better to talk to some doctor. Don't just wait, because if you wait and if the problem increases, then we are in trouble. So please, if there is any doubt, just pick up the phone, talk to your doctor, and if there is any doubt, we will come. Doctors like prominent vascular surgeon like Dr. Parakh will sort your problem out. So remember, corona is actually causing all problems through these vascular issues only, and we need to be very, very aware of these. Dr. Parakh, I'm very grateful to you for having come and given this very, very important advice. I think I'm very fond of saying that because it's so important, which is so preventable. As you said, don't smoke.
Absolutely. That is one thing that has to completely stop. And that is time out.
Thank you, Dr.
Thank
Parakh.
you. Thank you very much.
Thank you.